Hello, this is Ngozi Ono presenting on the relationship between socioeconomic status and healthcare disparity. Looking at the title page, showing legal justice emblem with a scale showing imbalance. This is similar to the relationship that exists when socioeconomic status dictates the delivery of healthcare services. Because the United States health industry is money-driven, it makes achieving maximum health dependent on patients' ability to pay. This perpetuates a social justice problem as seen in imbalance in healthcare disparity, similar to the imbalance in the justice emblem in this image. This presentation will define socioeconomic status and healthcare disparity, emphasize the inequalities of healthcare delivery on individuals or population with low socioeconomic status, highlight healthcare-related disparities that low socioeconomic status population encounter, discuss how socioeconomic status influences clinical decision-making by providers as well as healthcare outcomes. Agency for Healthcare Research and Quality, AHRQ 2016, infers that socioeconomic status refers to the social standing or class of an individual or group within a society. It connotes education, income, occupation, and sometimes the geographical setting of an individual or group. Same agency refers to health disparity as an imbalance in the prevalence of disease rates, and survival patterns in a society in comparison to the health status of the general population, AHRQ 2016. It further explained that the resulting health inequity has led to established health concerns for years in the United States, with principles and agencies set in place and a call for an awakening, reducing, or eliminating the problem. In response, Healthy People 2020 calls for the best possible health for all people, considering all as equal in addressing the issue of healthcare disparities, AHRQ 2016. Factors contributing to healthcare disparity, income and wealth. The inequalities of socioeconomic status determines the quality of healthcare service received by a patient. Because United States health system is market-oriented, affordability measures the healthcare given, creating a disparity with the haves and have-nots. Implicit bias. According to Appy et al. 2017, clinicians' perception of patients with low socioeconomic status have been shown to affect clinical decision-making and healthcare outcome. The implicit bias can be inherent due to culture or one's upbringing, and mostly unconscious. These perceptions influence diagnostic and treatment decisions during clinical encounters. There is also the structural/institutional bias that drives how and what care is given based on a patient's affordability. The effects of healthcare disparity. Dreyer et al. 2018 reported that socioeconomic status determines breast cancer treatment in women in their studies. They concluded that, quote, women with low socioeconomics are less likely than high socioeconomic status women to receive sentinel lymph node biopsy after breast conserving surgery. That also, low-income women were less likely than high-income women to undergo any axillary surgery and adjunct chemotherapy, unquote, Dreyer et al., 2018. They also noted differences in the use of aromatase inhibitors, AI, between poor and wealthy women. Poor women who initiated hormonal therapy will commonly depend on low-cost tamoxifen and rarely use the more expensive but effective aromatase inhibitors. Unquote. Schroeder et al. 2017 reported in their findings delay in healthcare and lack of preventive care. They noted where patients with chronic heart disease, CHD, delayed seeking health care until myocardial infarction took them to hospital. In high socioeconomic status, chronic heart disease is electively diagnosed, whereas in low socioeconomic status, with no preventive care or maintenance care or primary care and difficult to purchasing prescription medicine, emergency room becomes destination with acute symptom onset. Though the Healthcare Coverage and Affordable Act of 2010 increased the number of Americans with health insurance, many Americans are still uninsured, and some of the insurers are still struggling. Some of the insured are still struggling to pay the premiums and out-of-pocket deductions due to financial constraint. We have the poor and low-income population, people with no employment, the unemployable ones, and those that lost their job, all struggling with the task of accessing healthcare. It is very evident and clear that we have a social justice problem with growing healthcare disparities. The concern now is, what are we doing with it? The plan with the image on this slide shows a collaborative effort as the image depicts. The advanced practicing nurse with the increased knowledge of how low socioeconomic status factors impact access and delivery of healthcare is obliged to lead a collaborative effort, calling for all hands on deck, as we see in this teamwork, while aggressively advocating for social reform and engaging in activities to address and reduce conditions fostering healthcare disparity. The collaboration calls for communities, individuals involved, church communities, volunteers, government, American Nurses Association leadership backing, the government, etc. The APN also is expected to do a self-reflection to be mindful of one's own implicit biases. In conclusion, with a profit-driven health industry, there's a close relationship between the level of socioeconomic status and the quality of health outcomes across all populations, API et al. 2017. Low socioeconomic status patients and society at large are at risk when health disparity issues remain unsolved. With advanced practicing nurse leadership and collaboration of all, a political voice, mobilizing action that will effect a global change and that will benefit the health of all, when social and political barriers to equitable health are addressed. The goal is for a reform that makes accommodation The goal is for a reform that makes accommodation for the equitable distribution of wealth and health for all to reach health equity, as the image in this slide shows. This, the presenter believe, will be the national standard. Thank you. See the references.